failed surgeries, infections, chronic pain, not knowing if you're going to get your life back. This is Melissa's story. And in this episode, we're going to talk about this chronic low back pain. Melissa's story could be your story. It's a story of failed surgeries, infections, chronic back pain that no one knew how to fix. If that sounds like you, stay tuned for this episode.
Welcome to the Defeating Pain Podcast with Dr. Ted Arkfeld. If you're tired of treatments that just don't work, you're in the right place. Each week, we'll talk about new ways to beat chronic pain using at-home therapies. You don't have to go to the doctor to feel better. Let's help you start living pain-free. Now, here's Dr. Arkfeld.
If you're wondering why I'm dressed very casually today, it's Saturday. I just got back from treating patients at the clinic. I'm representing the Pelicans from Myrtle Beach, their pro team, and hey, it's comfortable. And it's late April, and it's still cold here in northern Michigan. Today, we're talking about Melissa. Her story starts really so many and with good intentions and a bad outcome. Melissa received a side posture adjustment from another chiropractor. And one thing I want to make clear is that not every technique is right for every condition. And in this case, it was not right for what Melissa presented with. And she presented with a disc problem, a very hot, angered disc. What happened is she had intense pain, and the pain went down into her legs, and it kept getting worse and worse as the hours went by. Finally, she went to the emergency room here in Gaylord, Michigan, and it was revealed at that time after an MRI that she had a prolapsed disc, a sequestered disc, and she needed to have immediate surgery. So she was transported down to Saginaw. Surgery was performed, and the next day, the back pain had subsided, except for obviously as a result of the surgery, but she didn't have any more leg pain or the burning in her leg, the sciatica, like we had talked about in the last episode. And it went really well. She came back to Gaylord, things were going well. And then a few days later, she began to have more pain in the low back, and it became worse and unbearable. So another trip to the ER, and she was diagnosed with having a staph infection. And so she had to go back down to Saginaw, and they did another surgery to clean everything out. Came back. She was seen by a physical therapist, went through, I believe, a couple rounds of PT, and she was still having pain. She went through pain management, epidural steroid injections, still having pain. So now this had been going on for 2 years. And she comes in to see me, and she's sitting there, and I could tell, like I could tell so many times with the chronic pain patients, they have just beat up and they're just on the verge of just giving up. And she immediately says, I don't know what I'm doing here. And I said, why are you here? And she goes, my sister says, you're my last hope. If you can't help me, I don't know what I'm going to do. So I listened to her story. I did the examination on her. And afterwards, I told her what was wrong with her. And I used the F word, not that F word. I told her I thought we could get her fixed up, and that everybody had been looking at her through an orthopedic problem, that we're going to start looking at it from a neurological aspect, and outline what we were going to do. So what did we do? The first thing is we put her on BioWave with the Cox flexion distraction technique, because her receptors in her skin, her muscles, and joint, they were not firing. Her brain had gone into what we call centralization. So it wasn't a structural problem. Even though she had surgery, and I know there was scar tissue built up, it still wasn't a structural problem. It was the brain had just got used to those pain signals making it up, and that these receptors not firing, not moving, and she just became wound up with pain all the time. So the BioWave was able to reduce that and reduce it pretty quickly. And then with the very gentle cox flexion distraction technique, we were able to get the muscles to start loosening up. We were able to get the joints to start moving. And we were able to generate a little increase in space between the vertebrae and also get the pressure off the discs. The discs were just angry again. So after a couple weeks of doing that therapy, then we transitioned her into ARP neurological therapy with the cox table. And now we're getting in there to the multifidus muscle who just took a beating. The multifidus muscles were just fried and they weren't working at all. So we were able to do the multifidus rehabilitation through art neurotherapy, 500 impulses per second. And we're able to get that brought on and build up. And again, we're doing that during the cox flexion distraction technique. It's what I call layering of the therapy is the fancy word now is called biohacking. So in the 5th week of care, we would start having her do the ARP neural, cox flexion distraction, and then at the end of that, we'd get her up and we'd have her do 4 sets of 5 toe touches with increased intensity with the ARP neural. And then we just kept progressing to where she was doing toe touches, and then she was doing squats, and then she was doing reverse lunges, and then she was standing on the Bosu ball balancing with the art neural. After every session, we also did Normatec and Brain Tap because there was such an emotional component. She was on her way to becoming depressed. She wasn't sleeping well. This is a mother too that's a school teacher. Her life had been taken away from her. And so at the end of 2-month care, she was back working out at her gym. Her pain was down to a 2 every now and then. She was able to stand and teach for a full day easily at school. And she said her life, she broke down and started crying and telling me that I I brought her life back to her. She did everything I asked her to do. She even purchased a PRF unit, which is the little home therapy unit of ARP Neural so that she could continue her therapy at home. She did remarkably well. She's still doing remarkably well. That was almost 2 years ago when that all came about, and she's still doing remarkably well. If nothing else, you can begin your own journey with home therapy, and we can talk about that as well. So I wanted to bring in a real life patient after I've been talking about what you can do. If you're in chronic pain, if you've had low back surgery, if you think there's been no hope and you just don't know where to turn, I want you to get in touch with me. I want you to comment and then subscribe and then tell other people. But more importantly, I want you to get in touch with me because I can talk to you. I can maybe find an art neurological doctor in your area that does cox flexion distraction technique and everything that we do.